Okay, we'll go in 5, 4, 3, 2. Welcome, friends old and new. Lisa and Anushya, thanks for being here today. We're going to talk about cannabis in Canada, which is, my favorite subject, and I think probably yours as well, if you're watching this or sort of talked about today. And Lisa, I want to start with you. A little bit of background for folks that don't know, although I think a lot of people, certainly the Canadian side, do know. You're one of the original dispensary owners and operators here in Ontario. You won a lottery, opened one of the first, and then continued that story into Stok'd. Give us a little bit of the background, and then we'll sort of talk about sort of how this story came to be.
Sure. I mean, at the time that we won the lottery, there were a whole bunch of regulations and terms around getting the store open. One of the challenges was financing. And so at the time, we chose to partner with a brand coming out of Vancouver who had a lot of money. And so we partnered with them. We opened the first store in Niagara Falls, the first legal store in Niagara Falls in 2019. And then the plan was, and what we did was we took that money from the partnership when they bought the store from us, and my husband and I started Stok'd in 2021. Sorry, we started in 2020. We got our first store open in 21.
It seems like it's newish, but that's still a long run for a store here in Ontario for sure.
It's been a lifetime. It's been a lifetime for sure.
We were saying we've known each other for a long time. It seems like decades, but it can't possibly be decades. It's probably more like 5 years, if that. And to make this so to sort of continue that a little bit further, you've been running sort of in some form or another retail operations here in Ontario for as long as anybody else. And one of the things, even we've talked about it before, people coming in and asking for medical cannabis or asking for health and wellness advice. Like how often does that happen within a Stok'd environment or sort of any dispensary environment here?
I mean, listen, I can cite examples from the first day we opened that store in Niagara Falls in 2019. One of the best days of my life, by the way, because it was just fascinating to watch it all unfold. And I personally spoke to a number of customers that day who'd come from the US, who had said, cannabis is the only thing that works for my multiple sclerosis. Cannabis is the only thing that helps me sleep, all of these things. And, from day one, we had to say, and we still do say, I'm great that it works for you. I'm not a medical professional. I can't give you medical advice. But from that day forward, of course, we have people coming in all the time. And it's not to say that the rec model is the solution, but it is the go-to spot for people who are looking for cannabis as an answer.
Yeah. And just for those watching now, there is no, and never was, medical dispensaries here in Ontario to access medical cannabis, unlike in most US markets. Certainly that's how many of this starts. Like there is only sort of physical locations to actually go and get medical cannabis, which brings us to you, Anushya. Talk a little bit about Apothecare, and then we'll get into sort of how you guys work together.
Yeah, for sure. So Apothecare is a pharmacist-led cannabis consultation service company. And so we service Canadians that are looking to use cannabis for health and wellness purposes. And we guide them. We do a full workup for these patients that we see, ensuring that cannabis is going to be safe for them. Safety is of the most importance. So many Canadians are on prescription medications. There could be prescription drug interactions with cannabis. And so we really do want to be mindful of that. Right now, just the statistics that the OCS has given out is that 1 in 5 consumers are walking into retail stores looking to use cannabis for wellness, which is crazy. 20% of these customers are looking for that, and there is no guidance. And so we're there just to kind of fill that gap in care at the retail level. We find that a lot of these consumers, they don't want to go the medical route. They find the medical route very convoluted, or they go and speak to their doctor. They're not able to get answers from their doctor, let alone they may not even have a family doctor to have those conversations with. So a lot of Canadians are just kind of left in limbo. And so our services are essentially geared towards the retail market, where we're able to guide these consumers in access processing cannabis and using it safely, and just giving them the knowledge in terms of how to be using it and products that would be safe for them.
Yeah. And so how does it work between the two? Like you're both on together here. If I go to Lisa, and she's, frontline worker at Stok'd, and I'm asking for something to help me sleep, for example. Lisa, do you say, talk to Anushya? I mean, roughly speaking?
Yeah, essentially. So we have some pamphlets and material in store that discuss the Apothecare organization and how that works. If a customer is asking us for medical advice, we of course say we can't give that medical advice, and we can reference the phone number and have them go away, or even stand in store, but go away and call Apothecare to have that entire conversation around drug interactions or what have you. And so then maybe Anushya, you can take it from there.
Yeah.
Yeah. So once a customer gets referred from Stoked to us, so customers can either book a consultation online or they can give us a call as well. So we have a 1-866 number. They speak with us. We ensure that, this is the best route for them to go. Some cases could be quite complicated where, for us, we're not going to be, handling customers that have MS or epilepsy. Those 100% do need to go to the physician. So we do that kind of screening process to ensure that this is the best route for them. If we find that it is the best route for them, we do an entire intake with that patient, and we work them up, and then we kind of book them in for a consultation. Typically it's about 30 minutes, where it's going to be virtual. So it's either a phone consultation or a video consultation, and we do everything through a clinic management software. So everything is HIPAA and PIPEDA compliant. So privacy in terms of all of this, patient data is secure. We do all of that. And then we connect back with the retailer to let them know that, consultation has been done. This is the product that I am recommending. I've already, gone through dosing titration schedule with the patient. They know what to expect. And then I let Stoked know. And I'll also guide the patient as well, just giving them a heads up that, I've spoken to staff. Your product is going to be ready to pick up.
So it's so smart. It's so
Right.
smart, and it makes so
Yeah.
much sense.
Yeah.
It
It's
really is,
yeah,
especially
like
as you,
the customer feedback as well with this service, especially for people that are older, right? Like, for them, just walking them through the process and kind of, giving them the knowledge, and for them to have a trusted healthcare professional, also a trusted retailer. I think that's so important because, I've done consultations where patients are going into illegal stores and they have no idea. And they have no idea that, oh my God, I've been going into cafe. I had no idea that that this was not a legal store. So yeah.
yeah, I certainly know that in my neighborhood where I live down the street from a cafe. Um, uh, and I want to ask you, Anushya, you said OCS particular says it's 1 in 5 folks going into a retail operation are talking health and wellness or wellness and medical cannabis. And of that, from your experience, is it the ones we know? Like, is it pain management? Is it sleep? Is it the things that we sort of come to expect from sort of people looking for either alternative treatments or treatments?
Yeah. So in terms of the medical conditions that we're seeing, 100% it's pain. It's chronic pain, neuropathic pain. We see acute pain, lower back pain, like you name it, it's there. Sleep as well. A lot of people are looking to turn to cannabis for sleep. Headaches and migraines we're seeing. Even, women's health when it comes to menstrual cramps. People are going towards using cannabis. So the list of conditions is just kind of growing and ever changing in terms of what we're seeing, but I would say pain and sleep are the top two. And just from our perspective, from our consultations, the average age of these consumers that are looking to get consultations with us is 61 years of age,
Ooh,
and they're on 3 or 4 medications,
yeah,
which is crazy to think that, there is no service out there to help this customer base.
yeah. And even as much as what our largest pharmacy is certainly Shoppers. Like I don't know if you went to a pharmacist at Shoppers that they would even talk to you about it, right? Like
No.
I, they would.
Yeah. Yeah. I used to work at a Shoppers, and it was funny because I was the only one educated.
Right.
And so all the pharmacists would say, go, please go speak to Anushya. Like, she'll help you. So
I love it. Of the pharmacists, you were the hip, cool one.
Yeah.
Still are. Lisa, does that age breakdown and I guess condition breakdown is like that jive with your sort of experience in this? Like, is it relatively older customers are looking for more and more information, but are like caught in this sort of regulatory gap, I would say.
Yeah, I mean, that's when ailments kind of start to position themselves in general, right?
You calling me old?
Pardon me?
Are you calling me old?
I think
No.
you already called me an old friend. So,
I didn't mean like that.
but at the end of the day, I also think there's some confusion in store because LPs are allowed to call their products night, for example.
Yeah.
But we're not allowed to sell that as a solution for sleep. We can sell it, but there's confusion in store and there's confusion for the customer because when we have to say we're not medical professionals, but here's a product called Night that other people tell us works for sleep. Where are we supposed to go?
Right. It's this gap. I mean, there's also this whole pre-roll that's like on and off. Which I do like. I'm not begging the LP. Like, I like the products; they're great.
Yeah.
But it is this thing like you are sort of limited to what you can say. Anushya is filling an important role there, certainly with the kind of customers we want to come shopping at a at a retail outlet in Ontario, right?
Yeah. Exactly.
And like sorry, go ahead.
No. We have bud tenders that are, it's a retail position. So some people are there for years working in store, but lots are there, during school or what have you. So at the end of the day, we are not medical professionals and we don't pretend to be, right? So we are put in a position where we're expected to answer questions related to health that we have absolutely no business answering. So thank goodness there is now this solution. In the past, we would just say, speak to your doctor, call this medical cannabis clinic. But if the customer says, whatever, I'm just going to buy it.
Right.
They just buy it.
Right, but they get it without even addressing their concerns that they may have about other medications, about are they using it right, and wouldn't it be better if they had that information from Anushya with just much more confident, informed usage?
Right.
Yeah, that's what we want, right, Anushya?
Yes, we do. And just to add to that, the number of wellness products that are coming onto the market now is crazy. And it's just to think like, so they're coming onto the market and, the government is letting these products onto the market, but then who is guiding these consumers? And then, you think about it from topicals as well. Like there's no one is buying topicals for recreational purposes. That doesn't make any sense.
Right.
So what is, Canada doing to support this?
Yeah. Well, I love this because to me it's sort of an innovation into a model that's existed for a number of years, and it's certainly filling an important gap, as I was saying, sort of. I don't know if it's called like in the regulatory environment, but it is important for consumers and for folks that want to use cannabis for health and wellness. So, Lisa and Anushya, I really appreciate talking to you this morning, but also for the work that you're doing.
Thank you.
Thank
We're
you.
really excited about this partnership.
Yes,
we'll see
super excited.
And we'll see you at Stok'd, Lisa.
Right?
Yes, absolutely.
Perfect.
All right. Thanks, everybody. We'll see you soon.
Thanks,
Thank you.